Um, I got a patient today. Room 143A, Mr. Blank Blank. This is patient is 50 years old. Diagnosis is cancer, stage 4. This patient have history of lung cancer. Patient of Dr. Blank, and he have IV side. He's on Heplock, and the IV side is on right upper arm and left hand. Um, Alert oriented. He can ambulate with unsteady gait. Family is on the bedside. He use urine now. Patient has no skin decube. Supposedly he's gonna have a chemotherapy today, but he declined it. He doesn't want to have a chemotherapy IV today because he had some reaction yesterday. So this patient was just put on medication, PO chemotherapy drugs, which is called Timodar. Timodar is chemo medication which is doesn't have much side effect. This patient lab result was okay. WBC was a little bit high, 15 point something. H&H is okay. This patient is on room air. Sometimes he will use O2 at 2 liters. He is also on antibiotic. He's on antibiotics, Socin 3.375 milligram, Q 8 hours IB. We don't need any specimen for this patient, so I'm gonna look for this medication. What is Timodar? My other patient is room 143A. This patient, 143B. No, it's 144B. This patient is a newly admitted, came here for nausea and vomiting and diarrhea. He came from ER. He is alert oriented ambulatory. He's on room air. The lab result, the liver panel was high. The AST was around 1000. The ALT was around 800. This patient has an IV on right hand. Have episode of vomiting on ER. Have episode of diarrhea, probably around 4 p.m. And I give Sopran 8 milligram. The order is Sopran 8 milligram Q 6 hours PRN. There's a consult. There's a GI consult, and it's Dr. Blanc. He was seen by Dr. blank, and and so actually there's no order from that doctor. So what we did, there's no diet order. So what I did is I called the doctor. The on-call doctor is Dr. Blank Blank, and I told her that the GI doctor write down on his progress note to put patient NPO accept meds. So I got an order NPO accept meds. There's some medication that these patients are taking. Patient medication is she's taking Celexa 10 milligram, and the other medication she's taking Xanax because she got a history of depression, history of anxiety. When she came here, she was really anxious. So what I did is I asked this patient that he need to call whenever he's gonna go to the restroom, because this patient has anesthetic gait. We have to help her. There's no skin decube. Probably her IB right now is she's on D5, normal saline at 100 cc per hour, probably because she is NPO. This the other patient is on room 140 blank 147. This patient has the diagnosis of anemia. We gave him blood transfusion, 3 units of packed red blood cell. There's an order yesterday to be discharged if after the blood transfusion is done, and if it's okay with Dr. Blank Blank. So and this morning patient was really anxious to go home, so when the doctor came in, he said to call the doctor, ask the doctor if it's okay for this patient to be discharged. So I called the doctor. He said he'll be here to see the patient.